training day for those in person and for all of you online. We're very excited to have you here for ADHD for Life, Navigating Challenges, Building Strengths. We're very lucky to be graced with Dr. Rylee Oram's presence. So I'll give you a little intro before she begins. So Dr. Rylee Oram is an educational consultant and learning strategist at the Child, Adolescent, and Family Centre of Ottawa, and a part-time professor at the University of Ottawa. With a Ph.D. in experimental psychology, she brings both research and practical experience to her work, supporting students and families with ADHD, executive functioning, and academic success. So I think you'll be in for a treat today. Thank you for being here.
Thank you. All right. Hello, everyone. I'm just going to make this little microphone adjustment here. Thank you to everyone who's in person. It's nice to see some people here as well as online. Thank you folks for joining us as well. So I'm very excited and privileged to be able to give this talk on ADHD. It's a topic that I'm incredibly passionate about. It is one that I did a lot of research on during my PhD, and I've been very lucky to work with a bunch of different kids and adolescents and adults with some of the challenges that they experience with ADHD, but also really focusing on some of the strengths that ADHD can bring to day-to-day experiences. So really trying to come at it from a strength-based approach, because when we think about ADHD, deficit is already in the name. And so I think we often really focus on those challenges. But I also want us to be kind of shifting to how do we ultimately kind of take some of those experiences and change them into strengths. So you folks heard a little bit about me there in that intro, which was incredibly kind. I don't know if I've ever been introduced by saying I graced you guys with my presence, but I appreciate it. So I have my PhD in experimental psychology. I worked in the ADHD and development lab here at U Ottawa with Dr. Maria Rogers, who is actually, she switched to the dark side and now she is at Carleton University doing research there. But we did a lot of work really exploring different ADHD populations, with her work really primarily focusing on families and children, and my work actually focusing more so on young adults and adults in a undergraduate and graduate area and context, particularly universities. And then I also did my bachelor's degree here as well. I am a part-time professor here at the University of Ottawa in the psychology department. I've been working as an instructor for about 5 years now. And I actually just had to present 2 truths and a lie to my students in social psychology. And one of the things I realized that I put in as one of my truths is that I've taught over 26 courses, which was very surprising when I kind of thought about that. So I've been doing it a lot in the past 5 years and kind of spread across different topics, including developmental psychology and lifespan psychology, and then child development, adolescent development, so kind of all over the developmental space. I'm also an educational consultant and learning strategist at the Child, Adolescent, and Family Centre of Ottawa. Educational consultant and learning strategist might sound like a bit of a vague term. Essentially, what I do is I ultimately work with my clients on building practical skills, mostly in a learning capacity. And that learning context could be in an academic context, but it can also very much be in kind of daily life. So trying to develop different skills or routines or habits that are going to be beneficial for them. And I work with a lot of folks who have been diagnosed with ADHD, but I also work with a lot of folks who simply just have difficulties with, let's say, attention or impulsivity. So it's not necessarily all folks who are diagnosed with ADHD, but that is certainly an area of expertise for me. I previously worked in accommodation offices, both at Carleton and U Ottawa. So a couple years, well, actually it's been about a year now since I worked at Carleton, but I was working there as a learning strategist and disabilities coordinator. So ultimately working with a lot of undergrad and graduate students that experienced a variety of different disabilities, both visible, non-visible, and the same thing here at the University of Ottawa. So I was working here as a learning specialist at the accommodations office for a couple years as well. So I bring a kind of mixed experience, one that's very research-based, and then one that is actually very practical based, especially when I think about my experiences as a professor here at the University of Ottawa, but also as a student at the University of Ottawa, right? Because that brings a lot of learning and a lot of lessons that now I can integrate into my practice with a lot of my clients. I've also been able to publish research on learning environments and ADHD, procrastination, motivation. So it's been quite a mixture of some of the really relevant areas or maybe challenges that folks with ADHD experience. So my hope today is that you guys will learn a little bit about ADHD, maybe above and beyond what you already know, but also have a greater understanding of some of the ways to manage ADHD and also how we can pull some particular strengths from ADHD as well. If you are someone that, let's say, has been diagnosed, maybe experiences some of the symptoms of ADHD, or maybe if you know folks that have ADHD. So first thing that I want to do is get to know you folks a little bit more because I just chatted about myself for a while. So there is a WooClap here. You guys can scan the QR code and you will see a page that will basically prompt you to hang in a moment because then I will start the questions for you. So I am going to also share, I think it should pop up for everyone here. Is it showing up on the screen yet? I think I might have to share the different screen. There we go. Okay, so I'm going to throw the first question up. If you folks don't get the QR code, you can join with the website as well. But I would like to know what brings you to the presentation today, because this will also help me contextualize some of the information that I'm going to be presenting. Okay. So a little bit of a mix so far. So some folks who have a diagnosis of ADHD, some who have suspected ADHD, and a lot of folks that know someone with ADHD, and a couple folks maybe coming here for multiple reasons, or maybe something a little bit different. That's great. All right, so mostly everyone has answered that one. So thank you, folks. The next question I have is, when you hear ADHD, what's the first word or image that comes to mind? What are some of the things that you folks think about automatically when you hear the term ADHD? Okay, so attention, absolutely. So that one is part of the name, of course, attention deficit hyperactivity disorder. Inattention, distraction. Okay, dissipated. Okay. Freestyling life. I love that one. Winging it. Absolutely. Okay. Maybe a little bit less planning and time management. Let's see. Impulsivity, scattered, complexity. Absolutely. So we're going to be walking through some of the complexities associated with ADHD, particularly when it comes to diagnosis across the lifespan. Creative. Love that. Someone already bringing in one of those important strengths. There can be levels maybe of people feeling overwhelmed, hyper-focused. Potentially people might frame that as, obsessive, or really having, a strong passion for a particular topic. Time blindness, absolutely. So sometimes not necessarily being able to capture how much time we might be spending on something or how much time has elapsed. And emotional dysregulation, difficulty managing time. Okay, excellent. So again, a lot of these are associated with common symptoms, right, with ADHD, and also fall under the category of executive functions. Okay, so we're going to talk a little bit about executive functions that are ultimately, if we think as our brain as kind of the hardware of a computer, executive functions is the software that's running on that computer. Okay, so they're ultimately the mental functions that our brain runs. And for some folks with ADHD, they just run a little bit differently. And so sometimes what we have to do is, focus on maybe building some of those strengths through different exercises and practices that allow it to kind of work the way that works best for us. All right, I have one more question before we start. And I want to know, does ADHD impact people similarly across the lifespan? Okay, I'll let the votes roll in here. I'm just about to teach on conformity soon, so I'm always looking for the person dissenting from the majority. One person sticking to it there with their yes. All right, so does ADHD impact people similarly across the lifespan? Well, that is something we will learn about today. But what we actually do see is that ADHD changes and shifts, and that can make diagnosis a bit of a moving target in the sense that we're not necessarily going to see the symptoms look the exact same in every different developmental stage. And we will walk through what some of those differences during those developmental stages look like, and also what some of the similarities are. Because what we often see, especially when we're looking at diagnosis, is there tends to be kind of a stereotypical way of thinking of ADHD that doesn't necessarily apply to a lot of folks, especially people in the older populations. And we'll talk about some of those challenges throughout this presentation. But thank you, everyone. That was excellent participation. And we will jump into the presentation now. So I do want to mention that some of this information may be familiar to you. If you are someone that has had a diagnosis of ADHD, it's possible that your doctor may have already explained some of the symptoms or what ADHD is, but it is important for us to kind of all be on the same page when it comes to the definition and understanding of ADHD. So it is considered a child onset neurodevelopmental condition. Actually, for a very long time, it was more so classified as a behavioral disorder. So as people gained more information and knowledge about ADHD and how our brain functions, it was reclassified as a neurodevelopmental condition, one that is much more complex than a lot of people initially believed. And more research is coming out that has really allowed doctors, clinicians, and also all of us to better understand different ways of supporting folks with ADHD. It is one of the most common psychiatric conditions diagnosed in children in Canada. We're also seeing that that prevalence rate is rising consistently, and we'll talk about some of the reasons for that later on in the presentation. It is often defined by patterns of inattention, hyperactivity, or impulsivity that are often developmentally inappropriate for the individual's age. So I will get parents from time to time or students maybe asking about some of the challenges that their children may be experiencing. And sometimes, we'll talk a little bit about, okay, what is actually developmentally appropriate, right, for, let's say, a teenager compared to what would be considered developmentally inappropriate. And what can sometimes make that challenging is that as we age, things are going to look a lot different, and our brain is consistently developing. So that's something that we need to take into consideration when there is a potential diagnosis that might be being discussed, right? Having a really good understanding of what are developmentally appropriate patterns of behavior, and then comparing those and contrasting those with those that might be more inappropriate. It is a disorder of self-regulation. It can impact focus, behavior, and emotion. So it is incredibly complex. And that's what also makes some of the treatment or intervention approaches of ADHD complex as well, right? Because you are trying to focus on behavioral components, but there are also some very deep kind of emotional and cognitive components of ADHD that we want to target as well. And then there are obviously the neurological components, right? Different parts of our brain potentially working a little bit differently when diagnosed with ADHD. And so that's where sometimes we'll see the medication side be very, very helpful for folks who have a diagnosis of ADHD. So there are different types of ADHD. There are 3 different types. So we have hyperactive impulsive type. This is often characterized by fidgeting. You might hear maybe excessive talking. There can be a level of impatience, and often we'll see kind of rash decision making. With the inattentive type, it's primarily focus-related difficulties. So things like, let's say, learning, there can be difficulties with work, but also sometimes difficulties in maintaining relationships. And then there's the combined type. So this is where we see both hyperactive and impulsive and inattentive features. Combined is the most commonly diagnosed type, but we do see some gender differences, particularly in children, with females tending to be diagnosed with inattentive type and males being diagnosed with hyperactive impulsive in childhood. And a lot of that has to do with the different types of behaviors that are being demonstrated. So for females, we'll often see more internalizing symptoms, whereas for males, we often see more externalizing symptoms. And so for a lot of females, they tend to fall under the radar, especially in childhood. Okay, because a lot of people are ultimately looking for those more externalizing symptoms to be able to flag someone for potentially needing that support. It can manifest differently across the lifespan. That's why I had that little question on there for you folks, because we see ADHD actually look quite differently or different between, let's say, childhood and an adult. So sometimes when we might look at an adult, you might actually think, okay, they're doing pretty good. You know, they're able to manage a lot of these components of their life. But then we actually see that a lot of that is compensatory strategies that have been built over time. And if we really reflect on some of the previous behaviors, let's say in childhood or let's say in adolescence, we actually do see that there tends to be a timeline of these symptoms kind of shifting and changing, but that people can often manage them quite well in adulthood, or at least mask the ability to manage some of these symptoms in adulthood compared to childhood, for example. So just to give you folks a bit of a snapshot in terms of the prevalence rates in Canada, now I will say they vary quite a bit, well, not quite a bit, but enough across research. So I didn't want to choose one specific study. I tried to kind of amalgamate things a little bit. But with preschoolers, we see about 1.1%. It's less commonly diagnosed in preschool, again, because it can be very hard to differentiate the developmentally appropriate versus developmentally inappropriate behaviors for children, right? Especially that young. We also know that there's a lot of brain development, right, that still needs to take place. So often a lot of doctors or psychologists will be a little bit hesitant to diagnose super early on, let's say around 3 years old. But obviously, if we are seeing a lot of detrimental impacts on daily functioning, then that would be something that would be considered. In children and adolescents, it's about 2.6% to 8.6%. So again, can vary widely. I would say that we often see in a lot of research, about 5%, 5 to 7% tends to be a little bit of a sweet spot. And that's something that we also see in young adults. So 18 to 34 typically hovers around 7.3%. And if we're thinking specifically of the undergraduate population, we do tend to see this 7% figure. So there was a national survey that was conducted that looked at undergraduate students, and we did see that that figure was very similar. For older adults, it is rising. Because of the awareness of adult ADHD. So it is around 5.5%. And when we look at the Canadian statistics, it correlates with being about 1 in 21 people who live with ADHD in Canada, which is approximately 1.8 million Canadians. So it is a significant portion of our population, which essentially really allows us to recognize that it's important for us to understand it and also to be able to support it in whatever capacity we can and to provide those levels of services and interventions. I also want to mention some of the gender differences in presentation. So I've already alluded to a few of them. But what we do see, like I said, is females tend to experience more internalizing symptoms. So we are going to hear from females often that they'll have difficulties with paying attention, difficulties with managing multiple priorities at once. There can be levels of disorganization, whereas with males, we do see more of that externalizing behavior. So maybe more risk-taking behavior, for example. We may see more frustration that, again, is more kind of outward and externalizing. And when we look at male children, we will also see that they're kind of the ones very stereotypical, bouncing around, having a difficult time sitting still, having to fidget, things of that nature. When it comes to females, there are also actually increased risks. And part of that has to do with some of those difficulties in diagnosing ADHD accurately for females. So a lot of females will go actually quite a long time without being appropriately diagnosed, which can lead to some of these increased risks, like self-harm and suicide risks, especially those who are higher in impulsivity. We see higher prevalence rates of depression, substance use, social rejection, and trauma. And there's also a higher risk of early mortality for females. And another important component of looking at females and ADHD is ultimately the hormonal changes that females experience across the lifespan. So we know that when adolescent girls start to experience puberty, that is going to shift some of those hormones, and our menstrual cycles as well will shift some of those hormones as well. That can exacerbate some of the symptoms of ADHD. And low estrogen and dopamine have also been linked to greater impulsive decision making. And women, towards later in life, they'll experience menopause, and they will also see that shift in hormones, which can make ADHD present differently as well. And it can complicate, right, that differential diagnosis often. Historically, ADHD, and I know maybe you folks can't see this quite as much, but historically, ADHD is diagnosed 2 times more often in males than females, again, because of a lot of the symptoms that we kind of stereotypically think of with ADHD, compared to what a lot of females tend to be experiencing. It's harder for us to be able to see those. And so often, again, they will fall under the radar, especially earlier on in life. This is actually quite, I have seen other figures that look at around 3 to 4 times. So this is actually a lower rate compared to some of the other research that I've seen, but this is more accurate to Canada's context. All right. So now I'm going to move into what symptoms look like across the lifespan, and hopefully this will give you folks a bit of a picture of how to differentiate them across each of these developmental stages. And then we'll chat a little bit about the course of ADHD and diagnosis, and then kind of move into some of the strategies that I typically recommend or work with my clients on. So in childhood, what we'll often see is a lot of that hyperactivity come out, especially for males. So as I already mentioned, fidgeting, inability to sit calmly, moving quickly. If I were to ask you guys, how do you envision a child with ADHD? I think a lot of us might really think about the kid that's kind of bouncing off the walls, maybe super chatty, right? Who's maybe, full of energy, talkative, extroverted. But we also see a level of difficulties when it comes to inattention still at this level. But it can really look a little bit differently in children, because it just might be them being calm and maybe playing, but they're kind of zoned out, right? They're not necessarily engaging with other kids in the same way. With impulsivity, we can see difficulties with turn taking. Kids might be a little bit more interruptive or disruptive with their classmates or their peers. There can be executive functioning difficulties, like following instructions, maybe losing things. So executive functions, like I mentioned, are those mental functions that we have that allow us to organize, that allow us to regulate our behaviors, that allow us to manage our time. And when we are children, our prefrontal cortex is not necessarily very developed. So again, a lot of these things can still be developmentally appropriate in terms of having some of the challenges. I'm not going to ask a 5-year-old to build a calendar and break down their tasks. But there's also some of these red flags that we might see when, again, the behavior is much more frequent or might be disrupting, again, that kind of daily functioning. Emotion regulation, there can be difficulty controlling emotions. Children can become very easily frustrated. And when it comes to physical development, we might actually see delays in speech development and gross fine motor skills. So that can be an indication that perhaps this is something to continue monitoring for a lot of MDs as well as psychologists or psychiatrists. All right, so adolescence is a complex one because we do tend to see that, during adolescence, there's a lot of changes that are happening. We also know that because of hormonal changes, there's going to be different manifestations of emotions and behaviors. There's also, that push and pull for autonomy. And we see that conflict with parents tends to be kind of at its peak around the beginning of puberty. So all of that sometimes can complicate what ADHD really looks like for adolescent clients. But again, it's really about looking at what is developmentally appropriate versus inappropriate and kind of what is the frequency of some of these behaviors. So with someone who might be demonstrating hyperactive behaviors, again, you're going to see that talking excessively, interrupting others, fidgeting. So fidgeting is going to look a little bit differently because social norms will play a little bit of a role in kind of how adolescents might act. So, it's not going to necessarily be the child that's running around the classroom and having difficulty kind of sitting down and doing things. They might be sitting down, but they're going to be trying to kind of stimulate in different ways, right? So that's why sometimes fidget tools or fidget toys can be really helpful because it's that displacement of some of that tendency to be hyperactive. Impulsivity could be easily distracted. It could also be engaging in risk-taking behaviors, also thrill-seeking behaviors, and making sudden decisions. For a lot of kids, it's really that challenge of self-control. So for example, I have a lot of clients who are teenagers, and one of the things they have a really hard time with is dealing with phones and any sort of distractions in their environment. It kind of sends them into a tailspin or sucks them in a lot, and they have a very difficult time trying to control some of those things that they might want to do. And I will also say that we see difficulties in conversations. So I like to say that it's like, how many of you know what double dutch is? Skipping. Okay, well, I'll just say skipping. So double dutch is when you have two ropes. And normally when you have this level of ability to self-control, you kind of know when to jump in, okay? When to jump into the ropes, right? Whereas for a lot of folks with ADHD, it's difficult to time that. They're just jumping right in, okay? They're getting caught in the ropes. So it could be a situation where they're in class and they know the answer, they're blurting it out. Okay, they're not waiting their turn. In a conversation, they might hear something that they're really interested in and interrupt. Okay, they have a really hard time being able to kind of hold in maybe their thoughts, feelings, emotions about a particular topic. We will see a little bit of that in childhood, obviously towards the end of childhood, just because as kids get a little bit older, their language and all of their other functions are going to be improved developmentally. But this is something that we see a lot of in adolescence and through adulthood as well. When it comes to executive functioning, this is where we really start to see some of these specific executive functioning challenges or delays. Things like poor processing speed. So they might be sitting in class and trying to take notes, and it's like they are sentences behind what their teacher might be saying. They might have difficulty sustaining attention. So I work with a lot of adolescents that have a really hard time sitting down and working through their homework, being able to read a novel. A lot of the students that I work with have to read novels, and that can be a major challenge. They have difficulty remembering information. Part of that is because of that distraction. In order for us to really be able to move our information from, let's say, working memory into short-term, long-term storage, we need to be sustaining that attention. And then a lot of folks will forget materials. I can't tell you how many times I have adolescent clients or parents who come in and they're like, they left their textbook, they left their Chromebook at school, we're rushing out the door in the morning, they're forgetting a bunch of different things. So that tends to be a way that we kind of see ADHD come out at this particular stage. And then there's also some difficulty with overreacting, irritability, or rejection sensitivity. So rejection sensitivity is where, we're kind of heightened in terms of people rejecting us and maybe, let's say, not wanting to be our friend or hearing us out. Now, again, adolescence, this happens, right? There may be a level of overreacting. There may be a level of irritability that's there. But we're talking when it's kind of next level, right? When it's very, very consistent daily, when it is significantly disrupting the ability for the teenager or adolescent to kind of thrive in a variety of different settings. So this is something that you're going to be kind of looking for over and above that kind of baseline level. Okay, so when we get to adults, I will say that this is probably developmentally the hardest age to really be able to condense down symptoms because they can actually look incredibly different for a lot of folks, right? You know, if there is someone who had an early diagnosis of ADHD, they have maybe been able to manage it to some extent. So that will change the way we see some of their symptoms. But if we're talking about someone who's coming in at a later stage in life, let's say 40s to 50s, some of these might, again, look very, very different. So that's something to keep in mind. And even if someone hasn't been diagnosed, they may have been, again, using those compensatory strategies for so long that it's almost masked a lot of the things that they are experiencing day to day. That said, when it comes to hyperactivity, you know, it's difficulty sitting through meetings. It might be bouncing between tasks, so kind of always needing to be multitasking. That's supposed to say always. So yeah, always engaging in kind of multiple things, trying to get stimulation from a variety of different areas. And it can also be dominating conversations, which goes along with some of the impulsivity symptoms we see, which is interrupting others, maybe making impulse purchases, also oversharing. Those are all very common ones when it comes to adulthood. Executive functioning is feeling overwhelmed, high level of irritability, could be difficulty remembering information. And with emotion regulation, it could be mood instability, lower threshold for stress. So, you know, compared to somebody else, they might have those additional difficulties being able to manage and prioritize and juggle a variety of different, you know, adult responsibilities. There can be a level of irritability and lower self-esteem. And we also see that there can be increases in things like substance use. And that can partly be because of some of the challenges that are consistently experienced for these folks. So this is just a snapshot of some of these symptoms. This is taken from Asherson 2024, so a fairly recent study where they really wanted to kind of categorize some of the behavioral manifestations of ADHD as well as some of the emotional components. So with preschool, again, there's that behavioral disturbance. We're not necessarily going to see the same level of internalizing. We're really going to see or be looking more so for that behavioral disturbance. School age or kind of elementary, we might see that behavioral disturbance. There could be academic impairment, difficulties with social skills. So part of that can come from that level of hyperactivity or impulsivity, but there can also be a level of that inattention playing a role in difficulty maintaining and relating to some of the folks within their classes. We often see that kids who are diagnosed with ADHD are often a couple years behind in terms of some executive functions and social skills. So a lot of the clients that I work with, you know, they might be in high school, but a lot of their friends are actually in, let's say, 8th grade or 7th grade, because there is more commonality between someone that's a couple years younger than them. With adolescents, again, we can see some challenges with social interaction and academics, but there's also that level of risk-taking behavior that can include substance use, but there's often comorbidities that start to show themselves a little bit more in adolescence, and we'll talk about those comorbidities shortly. With young adults, difficulties with daily tasks, occupational difficulties, again, some level of self-esteem, which is why there can be complexities when it comes to the intervention approach. And then with adults, there can be risks like unemployment, relationship problems, increased accidents because of inattention or distraction. There can also be challenges with substance use and mood instability. And again, kind of some of those challenges can be reflected in marital relationships as well. Okay, so we focused a lot on the difficulties associated with ADHD. But I also want us to think of some of the strengths associated with ADHD as well. So I'm going to pull up the woo clap again for you folks, so we can get a sense of some of the strengths that you think might be associated with ADHD. And I will put the QR code there just in case. All right. Okay, creativity is a big one, absolutely. So thinking outside the box, different perspectives and approaches, flexibility, yeah, hyper-focusing can be beneficial sometimes. Pattern recognition, being good at what they like. Let's see, yeah, passion of particular interest, openness, imagination. Yeah, passion again. Okay, excellent. Energy. Yes, and sometimes we need some of that energy. Yes. Okay, excellent. So you folks got a lot of the ones that we're going to talk about. Someone also mentioned meticulous. That's great. Okay, so some of the ones that I like to focus on, especially with my clients and when I'm doing any sort of psychoeducation with children, teens, or adults, we talk about some of these things. So you folks definitely hit on a bunch of them. So creativity and innovation, I see so much creativity with the folks that I work with who have ADHD. And a lot of that comes from kind of being able to come up with different ways of approaching situations. Higher energy levels. Yes, we see some of those higher energy levels for sure, especially when we're looking at children and adolescents. Although I will say a lot of the adults that experience ADHD may look at that a little bit differently because they have so many different things that they're trying to manage that can drain some of that cognitive energy a little bit more. Hyperfocus. So yes, when someone is very interested in a particular topic, a lot of kids or adults or adolescents with ADHD can definitely kind of hunker down and get into a flow state, so to speak. And a lot of that is, kind of the motivation with passion, which can be helpful, but sometimes it can be difficult with hyperfocus to be able to switch tasks. And that's where some of the challenges with hyperfocus come from. Risk-taking and adventurousness. So the risk-taking piece is not always negative, right? Sometimes it can actually be helpful for us to be able to go outside of our boundaries a little bit, right? Be able to learn new things, be more adventurous. But obviously, we want to make sure that that risk-taking isn't going into, a more dangerous area or context, right? We want to make sure that there is still a level of safety there. I would say one of the biggest ones I emphasize is resilience. Especially when we look at folks who have been in school and have had difficulties for a really long time, being able to persevere, right, and continue to try to navigate some of these challenges and still be successful is an incredible accomplishment. And so this is something that I focus on a lot. And you can imagine that for an adult that's navigated, let's say, their entire life, not knowing that they have ADHD and kind of wondering, like, what has been impacting my ability to do all of those things. It can be empowering, but it also really shows us how resilient they are because they have developed so many different systems or strategies that have helped them, right, to get to where they are. Strong problem solving skills, passion driven motivation, just like you folks mentioned. They can be very empathetic, compassionate, and sensitive, right? Being able to pick up on other people's experiences. This is something that we see a lot with adults. I will say that when we look at children, there can be some difficulties with perspective taking, and that's where some of those social difficulties can come from. But when we look at adults with ADHD, there has been that development of a lot of that compassion and perspective taking that can be helpful. And then often we'll see, especially in adults, like a very entrepreneurial spirit. Okay. So they like to try different things. They like to challenge themselves. And that can bode very, very well, especially if we kind of tie in a lot of these other strengths, right? Creativity and innovation, hyper focus, risk taking, right? All of those are different things that are going to play a role that can become ultimately massive strengths for folks with ADHD. So what does the course of ADHD symptoms look like? As I mentioned, they can vary significantly across individuals in terms of, how persistent or consistent they are across the lifespan. These are going to vary quite a bit because, to be honest, research is a little bit inconsistent, but I tried again to give you guys a bit of a guideline of what the percentages look like. So around 40 to 60% of individuals that were followed from childhood to adulthood with ADHD tend to have consistent and persistent symptoms. So let's say a child who's female was diagnosed with inattentive type, we would typically see those symptoms be relatively consistent across the lifespan. 15 to 40% experience some sort of remission of the symptoms, but these are often partial or they're kind of up and down. So we'll see that maybe a period of time, folks are doing really, really well. They're kind of finding systems that work well for them. And then we throw in, let's say, another job or a baby or something happening where they have to kind of find that equilibrium again, and that can be challenging. So that's why we kind of see a little bit of that remission of symptoms. And then 10 to 30% report like fluctuating and unstable. So they might actually experience a high level of hyperactive impulsive at one point, and then actually experience more of that inattentive type in adulthood, let's say. So it can vary depending on the person. But again, if we're looking at kind of the stereotypical course of ADHD, we might see that folks will kind of be more hyperactive impulsive as children. And as they kind of get older and out of adolescence, we might see things shift a little bit more into the combined or inattentive type. Persistent ADHD is linked to higher symptom severity and greater impairment. That's probably not a surprise there, but it does highlight the need for ongoing monitoring as well as individualized supports, because when it varies this much, it can be incredibly difficult, right, to be able to ensure that people are properly supported. And so we want to make sure that people are being monitored across these different developmental stages, because that will allow us to really make sure that the way that we are approaching it, right, the intervention approach is informed by where they are at. So for a diagnosis of ADHD, children up to age 16 have to display at least 6 symptoms of inattention, hyperactivity, impulsivity, or both. Whereas with adolescents or adults, you have to display at least 5 symptoms of inattention, hyperactivity, or both. And the symptoms have to be present for at least 6 months. They have to occur in 2 or more settings, and they have to interfere with or reduce functioning in different areas. So that's one particular thing that I think is important to recognize, because sometimes I'll have, students come up to me after class and they'll say, "Oh, at school, I have such a hard time paying attention. I can't pay attention in my 7 to 10 class. I think I might have ADHD." And so I kind of talk about it, okay, well, where do you normally experience this? Okay, well, it's actually just in my 7 to 10 class. I'm like, okay, well, maybe then it might not be ADHD. Maybe there is a high level of inattention. What are some of the strategies then that we can implement for that particular context, right? And with the rise of awareness and social media, I think that ADHD now has become like a commonly understood / misunderstood disorder. So it is important to kind of recognize what ADHD is versus maybe what some of the symptoms might be for some folks that don't necessarily meet that particular threshold. And I will say that in the research we conducted in the undergraduate population, there were a lot of folks that had very high levels of inattention, but they didn't actually meet the diagnostic criteria for ADHD. So we are certainly seeing a bit of an inattention epidemic at the moment that is certainly influencing folks. So even if you don't have ADHD, right, or even if you don't know anyone with ADHD, there can be a lot of people experiencing some of these symptoms, and learning about these strategies can help, right? They can help anyone that might be experiencing any level of these different challenges. Okay, so some of the current issues in diagnosis. So, diagnostic assessment of ADHD has actually advanced quite significantly in the past, like even decade or so. So, there's a lot of improved tools. There's also a better understanding of what to look for in ADHD. But some of the developments, despite them, we are still seeing some significant challenges because of comorbidities. We see a lot of the symptoms of, let's say, depression and anxiety manifest, and align or overlap with a lot of the ADHD symptoms. So it can be difficult to untangle that. There's also still levels of clinical prejudice when it comes to age. So, looking at children versus adults, as well as gender, as already mentioned. There can be a lot of masking, particularly for adults. And so that can make it very difficult to recognize whether someone is at a particular threshold for a diagnosis. There are considerable complexities in differential diagnoses that can play a role. And there's also levels of inexperience from, let's say, a doctor or MD's perspective when it comes to diagnosing ADHD, which can further complicate things. So the training to be able to navigate ADHD is incredibly important. I also want to mention in particular that for older adults and especially women, ADHD diagnosis has additional complications. So often when we look at adults and symptom presentation, there's going to be less hyperactivity and more inattention and executive dysfunction. But sometimes because they're internalizing symptoms, again, those can kind of mask as depression or anxiety. There's symptom overlap. So for older adults, there can be memory, attention, processing challenges, as well as medical conditions that can be very difficult, again, to parse apart and recognize, what is really related to ADHD versus what is related to the aging process. And those hormonal changes can also play a significant role when it comes to menopause and differences in estrogen. When it comes to diagnostic tools, there are few assessment tools that are actually validated for adults over 50. This is something that a lot of ADHD researchers are trying to improve, but it is certainly an area of challenge right now and still a lot of research. So I'm very aware of the timing, so I'm trying to kind of get through some of the stuff because I really want to talk about strategies quick. So when it comes to treatment of ADHD, pharmacological is one of the major approaches. Often this will be paired with behavioral and psychological therapies. Just doing the pharmacological, the issue with that is there isn't going to be the same level of learning, right? Different strategies. It might kind of open, a little bit of space and cognitive energy for things, but it's not necessarily going to teach people these particular routines. So if they were to not take their medication, then we wouldn't want them to be kind of back at square one. So people might be prescribed stimulants or non-stimulants, depending on age, depending on other medications. Behavioral and psychological therapy, CBT tends to be very powerful because of some of those impacts, especially in adolescence and adulthood when it comes to self-esteem, substance use, right? Difficulties with day-to-day life. ADHD and executive function coaching is an area that's kind of coming up a little bit. This is something that I kind of focus on while also trying to integrate other approaches like CBT, like motivational interviewing. So those are often informing my practice as well. And then there can be some benefits to mindfulness-based approaches that helps people kind of practice that regulation. And then family therapy for families that might be having difficulties. Because often if a child is diagnosed with ADHD, there tends to be ADHD within the parents as well. And so it's trying to manage, the family as a unit. And then there can be lifestyle and self-management that people can integrate. So, things like sleep hygiene, physical activity is incredibly helpful. Dietary considerations. There isn't strong evidence for any sort of elimination diets, except in very rare circumstances. I've seen a lot of ADHD nutritionists nowadays, and there's not a lot of research that emphasizes that. So what research really supports right now is having the pharmacological approach as well as behavioral and psychological therapies, and then some of these lifestyle changes that can be helpful. All right, so this just kind of gives an idea of what the approaches would be based on the developmental stage. So preschool, you'll see a lot of behavioral interventions that include the caregiver. So it provides caregiver training and support. And there may be a possible use of a norepinephrine reuptake inhibitor. So that is atomoxetine. But again, a lot of psychologists and MDs try not to integrate medication super early on. In late childhood, you'll see behavioral strategies, maybe CBT, and then the introduction of a stimulant medication. So something like methylphenidate. And then same thing with adolescents and adults, but it is important to recognize for older adults, you want to make sure that there aren't going to be any issues with medication that might already be taken. So that is a case where maybe instead of a stimulant, they use a non-stimulant medication to help folks with ADHD. Okay. So now I just wanted to provide some very practical strategies for folks managing ADHD. I think one of the most powerful strategies is ultimately building awareness, right? Building your self-awareness about what you're experiencing, what works well for you and what doesn't work well. Because in a lot of our environments, there tends to be one approach, that's a one size fits all perspective, right? We think about education, we think about work, we create these structures that may not necessarily work well for everyone, especially someone that's experiencing ADHD. So we want to ultimately try to figure out, okay, well, how do I make this environment work for me? And how do I kind of adapt my approach based on what I'm experiencing day to day and kind of what I'm trying to manage? So kind of building awareness, what environments are you most productive in? What makes you feel comfortable? What are some of the areas that you have challenges? Is it distractions? Is it inattention? Is it hyperactivity? And then trying to pair some of those things with particular strategies or intervention approaches. For folks that have difficulty with attention or impulsivity, obviously identifying and removing those distractions is incredibly helpful. Our phones, unfortunately, are very big ones. But we see that for people who are adults with ADHD, their phone might be something that's incredibly important that they feel like they kind of have to have around them at all times. So trying to remove that whenever possible can be very helpful. Use of calendars and organizational apps. Now, the one thing that I want to mention with this is that we don't always want to necessarily be adding steps for folks with ADHD. So if they have to go into multiple apps and manage them, that might not be particularly realistic. So again, we want to try to pare it down as much as possible and figure out, okay, what is the easiest approach or the path of least resistance to be able to manage things? And I always say to clients, we want it to be as realistic as possible for you. We don't want to be putting in a bunch of stuff that you have to do that ultimately you're not going to end up doing consistently. Self-compassion, incredibly important. Being able to recognize, okay, maybe I made a mistake here. Maybe I had difficulty keeping up with something. Maybe I lost my attention in this situation. That's okay. It happens. But what can I implement going forward, right? So really looking forward about how do I just kind of adapt and adjust my approach so that it works a little bit better in a particular context. And then establishing routines and structure, using habit chaining, for example. So establishing routines is so important because we want automaticity, right? We don't want to have to use a lot of cognitive energy. So if it gets to the point where you have those routines and you have that structure, then you don't need to be constantly thinking about it all the time, right? It just becomes something that you do inherently. And anytime we can use habit chaining, which is essentially putting something together with something that you already do regularly, that again takes away some of that cognitive energy. So for some of my teens, let's say, or some of my clients who have difficulty taking their medication routinely, one thing we might do if they're getting up every morning, they're brushing their teeth, medication goes directly beside their toothbrush with a cup because they already do that every day without thinking about it. And then we're just adding that into their particular routine without a lot of additional work that they would have to do. So Try to keep it as simple as possible. Simplify your approach. I also always say, take things one step at a time. If you have a task that feels overwhelming, it's really looking at it and going like, literally, how do I put one foot in front of the other? Because you really want to just reduce things down to very much clear and achievable actions, right? And I say achievable in the sense that we want them to be as realistic as possible. So sometimes it really is just kind of saying to yourself, what is just the next thing that I have to think about? What is the easiest way for me to approach this? If it's, making dinner and thinking about dinner, okay, well, it's looking in the fridge and seeing, what do I have? What can I use today? Maybe then it's punching in some of those ingredients into, a website and figuring that out. Here are some other resources for you folks. So there's a bunch of books here that vary depending on the developmental stage they focus on. I also have some websites here that have a lot of excellent resources. I will say that one that I personally really liked is Scattered Minds. I thought that was a really, really great book. And actually, Feel Good Learning. It's written by a learning specialist from Toronto. And for folks that have difficulties in an undergraduate or academic context, this is an excellent book. It has a lot of great strategies in it. And then this is a book that has come highly recommended for older adults with ADHD. So there are a lot of different options here. And then I have some time management apps and wellness apps, some of which are free, some of which have optional subscriptions. But these have been ones that have been incredibly helpful for a lot of my clients. All right, so to finish up, ADHD may come with a lot of challenges, but I would also say that it also comes with a lot of opportunities for kind of designing your life, so to speak, and really trying to figure out how to work with your brain and not against it. So not feeling like you have to do exactly what everybody else is doing or to frame things exactly like everyone else. It's really about, how do we create systems that work for us, and maybe a system that is not necessarily created for us. So I'm going to give you guys some time. I'm sorry, I think I only have like a little bit of time for questions. This is my contact information, and this QR code goes to the CAFCO website with all of the work that I do. So if you are interested in learning a little bit more about that work, you can scan the QR code. And then I have some of my contact info here. So I'll open it up for questions.